right. Yes, well, welcome. Thank you for having me. It's an honor to be talking to you all in Idaho. I'm over in DC, the suburbs of DC in North Bethesda right now. My office is in Northwest Washington, DC. So anyway, just a little background. Let me first make sure my slides are working. Okay, there we go. So I'm a child and adolescent psychiatrist. I've been in private practice in Washington since 2008. After doing my child and adolescent fellowship at the Children's Hospital there, I had done my adult psychiatry residency in University of Pittsburgh. And I actually specialize in treating internet and video game use disorders. And even before I went to medical school, I had a background in programming and computers and doing digital technology. And in fact, I was also quite a big gamer myself growing up. So when parents would bring their kids into my practice and say, I think my kids are addicted to video games. Usually they would come in and they would have been already diagnosed with something else by some other clinician they saw before me. Because, back in 2008, when I started practice, we didn't have any training in residency or in medical school on video game addiction. It was really not thought of as an addiction by most people, I believe. And so the kids would usually come in, they'd have a diagnosis of ADHD or autism or anxiety or depression. And usually the treating doctor they had seen before me would be like, well, if you just treat their ADHD with a stimulant or you treat their depression, their video game addiction will go away. Although they didn't call it that. So, but the parents would be like, I'm really sure that my kid's addicted to video games. And this was right when video games started to become more multiplayer, and I'll talk about that in a minute. So I would do their evaluation, and I would often find that these kids had some of the same exact behaviors that I saw on my addiction rotation, which I'm going to get to in a minute. But um, that I started to think that maybe there's something real here. And I started to connect with other colleagues around the country who were studying this. And I actually did some contributing to the literature. I did a review article on the where I compared a lot of functional MRIs of the brains of people who were heavy video gamers to the brains of and studies that were about drug and alcohol abuse. And I did a review article on the biology of gaming addiction. I found out that there was a lot of similarities and final common pathways, some of which I'll talk about today. And one of the issues that comes up a lot is once you've accepted that kids are using screens excessively and that it's problematic, there's debate about whether all these other diagnoses that these kids come in with, like ADHD and autism and anxiety and depression, other substance use problems, there's always like a causal debate. Are they addicted to screens because of anxiety or depression or ADHD, or do they have does their depression or their anxiety get worse because they're on screens so much? And because correlation does not equal causation, you can get into a lot of long debates over that. But one thing that I realized from really focusing on this, especially for the last 10 years of my practice, during which time I've only exclusively taken patients who have excessive screen use as one of their primary complaints into my practice. And that was right before the pandemic started, at which time the problem took off. But one thing that I've really discovered from my experience is that regardless of what causes what, if you don't address the elephant in the room, you won't have access to those other problems from a treatment perspective. So you're not going to be able to really adequately help with the problems they're coming in for, like ADHD and autism and anxiety and depression, if they're constantly on screens, if they're using excessively. So it becomes a big elephant in a room that a lot of clinicians may shy away from addressing. And so I found that like early on in treatment is the time to address excessive gaming use, or excessive screen use, and that it really should be part of the screening as well. Because once you've addressed the elephant in the room, you have a lot more access to treating the other problems. But let's go back to like the basic definition. And because I'm speaking to clinicians today, I know a lot of you are familiar with this, but it's worth reviewing just what the basic definition of addiction is and why we can call this an addiction, right? And you know, we can start by talking about some of the problems that patients and clients might come into you for in the first place. Maybe these kids are being aggressive. They're when their parents try to cut them off of screen time, right? Maybe they're lying about screen use or lying all the time about everything. You know, their parents have lost all trust with them, or their friends, or their family. Maybe there's like I've had cases with people who present who are stealing all sorts of money from their parents to give themselves a better gaming experience. You know, often it's thousands of dollars, and often it's by just taking the parent's credit card out of their wallet and charging it. It's not even necessarily by hacking into the parent's funding. And then finally, you know, there are cases where kids will threaten to kill themselves if their games are not or if they're asked to get off their video games, or if they're cut off from their screen time. So, you know, there's all sorts of these classic problems that you might see that you might also see in drug and alcohol abuse. And so, but, you know, oftentimes we'll call them seeking behaviors. Um, and that brings us to the definition of addiction, which is very much contained in the World Health Organization's definition of gaming disorder. Well, I actually am getting some noise in the background. Please make sure you're on mute if you can I just ask everybody to mute themselves?
Thank you.
Okay, sorry about that. Anyway, so the World Health Organization has defined gaming disorder, which will be in the DSM. I'm sorry, in the ICD-11. Currently, we're using ICD-10, as you know, but they've used the classic addiction definition and just incorporated it into gaming. And you can go to their website for this as well. But gaming disorder is defined as a pattern of gaming behavior characterized by impaired control over gaming, increasing priority given to gaming over other activities to the extent that gaming takes precedence over other interests in daily activities, and continuation or escalation of gaming despite the occurrence of negative consequences. Behavior pattern must be of sufficient severity to result in significant impairment in personal, family, social, educational, occupational, other important areas of functioning. So to summarize, they're really talking about the problems caused by gaming. And that sort of can remind us that you don't define, for example, a use disorder of a substance or alcohol or gambling by how much the person drinks, or how often they drink, or you know how often they gamble. And it's real. We're not looking at how much people game, or how often they game. We're looking at the problems caused by the fact that they can't stop gaming. And that's really what addiction is about. You know, you can call it, if it's just a matter of needing to do something all the time, you have dependency. But if you're having problems from doing it all the time, that's when it becomes addiction. And so a lot of kids will say, you know, am I addicted to video games? Now, if you go by that definition, there's a couple of other interesting things about it. And by the way, the DSM also has Section 3, Internet Gaming Disorder. That their Section 3 is for provisional diagnoses, so it's not an established diagnosis. It's a condition requiring further research. So they have internet gaming disorder. The World Health Organization has gaming disorder. None of it is stuff you can bill or code for yet. But there's a couple of interesting things about these definitions. One is that they're really focusing on gaming in both cases. They're not talking about social media. They're not talking about internet use. Now, I would suggest that that's mainly because most of the research out there is on gaming. It's not because these other problems don't exist. In fact, I would say that um, there's a blurry line between these different ways of using digital technology now. That social media is gamified more. Gaming has become more like social media. As an example, people are watching streaming videos of other people gaming. And so I would really hope for a definition that encompasses all of like excessive, compulsive, problematic screen use, but this is what we've got, right? And so that's one thing about the definition. And let's see. Um, I mean, I guess we can come back to that, but let's talk about what it is about digital technology that makes it addictive in the first place. Why am I not doing this talk about, homework addiction or violin addiction? What is it? Why do we look at all this screen use as something that can cause a problem in the first place? What's sort of the common bond between all the stuff that kids do on screens that becomes very difficult for them to stop? So if you take a look at all devices, in particular a cell phone, I like to call it a virtual shortcut machine. Okay, because uh, you can use a cell phone to do a lot of things that you might do in the real world, and they're not necessarily done better, but they're done much faster. So uh, it's a shortcut to everything. And just to illustrate that even further, we pull it out of our pocket whenever we need it, no matter where we are. So we always have immediate access to it more than other devices, which we may have to go home to use. Um, but as soon as we turn on the screen, we can type in what we want and it's doing it for us. So let me give an example. Let's say that, you're playing for the University of Idaho, or you go to University of Idaho and you want to play for the football team, and then you want to become an NFL superstar quarterback. Um, Normally that would take a lot of training, a lot of practice, a lot of hard work, a lot of sweat. And then even once you've gotten there, you still have to go to the game. You have to suit up. You have to sit on the bench. You have to wait for your number to be called. There's a lot of work and patience involved and a lot of effort put into it. Or you can just, turn on a console and play Madden, and immediately you're a star NFL quarterback throwing a football. Now you might say, okay, well, that's not really the same thing. You can't even compare the two. The real life one is much better. Right. But the thing is that the virtual version of it was much faster. And that's the key, because the brain, particularly the dopamine system of the brain, cares more about speed than anything else. So if there's one thing that there's consensus on in all the drug addiction literature and all the addiction literature, it's that how addictive something is primarily determined by the latency, which is the time between when you want to get the effect and when you actually get it. So it's the number one predictive factor of how addictive something is how fast it gets you high. The reason that cigarettes are as addictive as substances like heroin that get you much, much more of a buzz is because they work really fast. You smoke them and you immediately get the effect. So people think of the dopamine pathways as the reward system of the brain, and I have them pictured here in blue. Um, there really should be thought of as the get what you want when you want it system of the brain, right? You don't necessarily be having to get pleasure. You just have to be getting what you want instantly. So it's really the instant gratification system. And so that's what it really is about digital technology, is that it gets us what we want faster, not necessarily better. And so when you're getting what you want right away, and by the way, we know that human beings have well, we know that all species have a dopamine system that helps them go after what they want and survive. And we know that like there was an evolutionary advantage to getting things instantly. Like say if you're a caveman and you're the first one to get to the mammoth, you're gonna eat and survive. But uh, but so you can, well, actually, let's just think of the brain as like a driver and a brake. So you can think of the arrow, the green arrow, as the flow of dopamine um, leaving from the ventral tegmental area of the midbrain and going out into these reward pathways of the brain, these blue pathways. You can think of that as the sort of the gas pedal of the brain. In other words, when we see something that we want right away, we go after it. But the way human beings are different from other species is that we have a more advanced braking system of the car. So, in other words, so while the green arrow is the flow of dopamine, the red arrow is the counterforce to dopamine, which is the prefrontal cortex, right? So the prefrontal cortex is like the brakes of our brain. And if we're on a video game and we need to stop, we have to use our prefrontal cortex. And that's why humans have such an advanced brain and such an advanced prefrontal cortex. We're the only real species that have any brakes whatsoever. You're not going to see your pet dog, uh, wait to eat because they're on a diet or because it's not dinner time yet. Only human beings can do things like that. And one of the problems is that teenagers, just like people with ADHD, they don't have as well developed brakes as adults. We know that the prefrontal cortex continues to form into the late 20s. And that's why one of the reasons why a large percentage of the patients that I treat in my practice are teenagers. So that's sort of, I guess, the main take-home point of this talk, if you remember nothing else, is that all of these addictions have this final common pathway of providing instant gratification to the brain. And uh, that's the main appeal of this digital technology, that it gets us everything so fast. But there's many other things about digital technology that are really appealing to my patients. And for example, they're in a virtual world where they can escape from whatever they don't like about the real world. And in that virtual world, they can be another character, maybe one that's like themselves, where there's an avatar that has features that they have, or they can be something completely different than themselves and maybe something that compensates for whatever inadequacy they're feeling. And so you see, these are screenshots from Genshin Impact, which is a massive multiplayer game that people can download for free online. This is let's see. This is a a gaming center where you see people just completely uh, it, you basically see them completely immersed in their virtual world because they've got the goggles on, they've got track pads on their shoes. When their character walks around, their avatar walks around. So, and here you can see there's a fantasy world that you can game in. I think that's World of Warcraft, but I'm not sure. these games provide us with fantasy, they provide us with escape, they provide us with a virtual world that sometimes, has the things that you don't want, that has things that you want that are not in the real world, and that doesn't have the things you don't want in the real world. You can also achieve mastery in video games. And this is a very popular game with the kids I work with now called Minecraft. And you can see that the amazing thing about Minecraft and the way it's revolutionized gaming and games like it is that the content is all generated by users. So the developers of the game, they just throw out this sort of simple world with a bunch of blocks in it, but you can dig in the blocks and you can use them like virtual Legos and make it into these amazing worlds. And you can even code in those worlds. And here you've seen that you've gone from, the simple sort of basic Minecraft world to a lot of games within that world. And you can walk into the world. So you can not only master creating worlds, but you can master other people's worlds by going on their servers and playing games that they've made. So there's endless layers of mastery. And when I was growing up playing these single player adventure games, they're really all you could do for most of those games was solve all the puzzles and beat the game. And then it was over and you'd get another game. Games now, they're open world, user generated, they go on forever, and there's endless mastery. You can keep leveling up. Gaming is also a tremendous social aid for our kids in a way that it wasn't when I was growing up, because multiplayer gaming has become the main thing right now. And you can see in the picture kids dressed as their characters in the game Fortnite at a gaming conference. And whenever I see that picture, I think of the gamers in the masks, like the guy in the tomato, and how, maybe it's really a lot easier for him to socialize dressed as a tomato than it is being himself. So it kind of levels the social playing field. Now, this app on the right is Discord, and it's how all these gamers are communicating with each other now. And in Discord, there's a lot of there's many ways to find out where the other gamers are gaming and to meet up with them. There's ways to communicate with them that include texting, audio, video. But in general, again, it's a way to level the social playing field, because you don't have, it's a completely different way of socializing when you're on Discord or in the game socializing. You're not necessarily revealing a lot about yourself. You have a bit of anonymity. And a lot of the patients I work with are in the autism spectrum, and I feel like they really have a level playing field when they socialize in the game world, to the point where a lot of their parents feel heartbroken about pulling them out of this situation because they struggle socializing when they're not in that situation. And they're finally comfortable socializing when they're in that situation. The big myth about autism is that these kids don't want to socialize. And any parent of kids in the spectrum will tell you that's not true. Okay, so that's the social aspect of gaming. And now another thing we understand about gaming and the internet in general is that it provides a lot of variable ratio reinforcement. And those of you who've studied Skinner might recognize that term. That's basically the reward that you get from random chance. So in other words, in Skinner's experiments, when he would have mice push on levers and they would get pellets of food as a reward, the mice that learned the best and took the longest to extinguish what they had learned were the ones who got rewards that were intermittent, that were not given to them on a regular schedule, that were random, right? And they called that variable ratio reinforcement. And you see that in the slot machines at casinos, right? You don't win every time. And it's completely random. And games like the one I have in the picture, Candy Crush, they're made with layers upon layers upon layers of variable ratio reinforcement. And if you think about everything on the internet, it's really the world's biggest slot machine. If you just think about the posts you might be scrolling through on Facebook, right? You, you might find yourself on autopilot doing the endless scrolling and being like, why am I doing this? Most of these are really lame and not that entertaining. Well, this is why, because your brain knows that at any point you might find a really interesting post or a really funny or amusing post or one that really appeals to you. So even if the algorithms that are trying to give you what you want in your posts aren't working perfectly, it doesn't matter because you only have to be getting what you want some of the time. And then you get that variable ratio reinforcement, which Skinner showed us is actually a stronger form of reinforcement. Now, so basically what it comes down to is that you have kids on these devices and they have a really tough time getting off. And so when you don't have the brakes working the way they should be, and you have this constant flow of dopamine, what is actually happening to the brain? What is the danger? Now, when my patients come in and maybe they're a college kid, a first year who's dropped out of college from being on screens all the time, maybe they're a high school kid who stays up all night, and doesn't or wants to stay home from school playing video games. um, these kids can all tell me, well, yeah, of course, if I spend many hours on my video games, that's hours I'm not going to be sleeping or doing my work. That's kind of obvious to them. But I like to use what we know about the brain to illustrate to them why it's more of a problem than just the hours lost to gaming. There's actually a residual effect when you binge on games. And so I created a little animation to illustrate the effect of doing any source of dopamine excessively on the brain. And it shows the synapse of the brain along the dopaminergic pathways, right? So it shows a synapse between a presynaptic brain cell and a postsynaptic brain cell or neuron. Okay, and this is this illustration would be if you were to go on a microscopic level inside this guy's brain, and let's say he's our gamer, right? So I what I did was I took the dopamine molecules and I represented them with little Pikachus so that gamers could connect with it. And what what you can show with this model is that I made little Pokeballs represent the receptors on the postsynaptic neuron. And this demonstrates that at all times there's some baseline level of dopamine flow in the brain where the dopamine molecules are going from the presynaptic neuron into the receptors in the postsynaptic neuron. And then I use this model to demonstrate to kids why it is that binging on games is a problem. So once he gets on a video game, he's going to get a lot of dopamine flow and he's going to start enjoying himself because there's going to be a lot more dopamine molecules going into the receptors. But the problem is when you do this for days and days and hours on end, what happens is that you get down regulation of postsynaptic receptors. So that's what we call tolerance. So this is a helpful way to sort of visualize why when you've been on games for hours and hours and days on end, you're no longer doing it because it feels as good as when you started doing it. You're still getting the dopamine flow, but because you have fewer receptors, you're not enjoying it as much. This is tolerance, right? But that's what tells us that the reason somebody's gaming after all this time is because of what will happen if they stop. So let's say that, a family member intervenes, they come in, they get them off the screen somehow. What happens? Now you're removing the dopamine, but you have fewer dopamine receptors. So the net effect is withdrawal. Because now that you have less pleasure and even fewer pleasure receptors, and they take time to come back, now you feel worse than when you started, and that's withdrawal. And gaming addiction withdrawal is something that's described in the literature. In fact, it's been described as something called reward deficiency syndrome, and it's characterized by days after you stop feeling more bored than usual, feeling irritable, and you know uh, uh, maybe being aggressive. And so a lot of parents have had to deal with kids in this state. And maybe some parents have experienced it themselves as well. So, so with that model, you can kind of explain that when you binge too much on anything dopaminergic, but in particularly games in this case, that you get even more bored than you were to begin with. And that creates a vicious cycle because then you seek more rewards and then you binge more. And so, if you can explain this to your patients, all of a sudden they may realize that it's not just the time lost to games, that it's a problem after you stop as well. And that's very important. This is why kids who are on screens all weekend may have a really bad day at school on Monday. Now, the process is reversible, as far as I know. We could talk about ways of kind of detoxing to restore dopamine receptors. Uh, and then, I'm hoping with more research, we're going to understand how long it takes to reverse that process. But I'm going to tell you a little bit about my own experiences with dopamine detoxing based on that model and how it's gone. But let me just sort of say that, you know, and this is why I don't like it when they define addiction as just about one particular substance or thing, because people will hop from one source of dopamine to another. So you have the kid, for example, in this picture, who's been on their computer playing a video game all day, and the parent intervenes and they get them off and they get them into bed where there's a iPhone waiting, charging next to the bed. They get on the iPhone, and all of a sudden they're watching other people play the game they were playing all day on the iPhone. So the problem is that people will hop from one form of dopamine to another. This is why maybe when you look outside an AA meeting, you may see people on the steps during their break, looking at their cell phone and smoking cigarettes. So I think that's a very important part of for anyone to realize when they're dealing with any type of addiction, that you can hop from one form of dopamine to another. So now let's get to treatment. Now that we've talked a little bit about the types of problems I'm looking for and how to assess them. So I have this tendency among the parents I work with where they're really focused on productivity. They really think that the biggest problem with screens for their kids is that they're not being productive. And so they really think of it as work versus play. In fact, a lot of parents will give their kids as much video games time as they want, or as much screen time as they want, as long as they finish their homework. And what happens in many of those cases, as you can imagine, is that the kids will rush through the homework and maybe do a very sloppy job so that they have as much screen time as possible. So I try to use a model with parents when I'm educating them that's more focused on thinking of things in terms of high dopamine activity, which I define as activity that's instantly gratifying, right? Instantly and continuously gratifying, versus low dopamine activity, which I define as activity that takes more patience. And by the way, coming back to the other thing I was going to say about the definition of addiction earlier, if you really think about the definition, it's really a continuum. You can be very addicted to something, or you can be very little addicted to something based on how severe the problems are, right? If using screens all the time brings your grades down to a C average, it's different than if it makes you drop out of school completely and has you get all zeros, right? So there's different there's severity when it comes to addiction. Similarly, I think it's a continuum with activities. You can have activities that are very instantly gratifying, and you can have activities that make you wait a little longer, and activities that require the most patience, right? So I am oversimplifying this model by just saying it's high dopamine and low dopamine activity. But I find that it's helpful for parents to try and separate activities into those two categories. You know, um, the goal of treatment then would be to help patients balance the two, the high and low dopamine activities. And let me give you an example, um, the high dopamine activities are the ones we talked about, right? The streaming videos, the games, the social media. Um, Low dopamine activity may be the really obvious ones, like doing homework or exercising in a gym, but there may be some things that are, typically high dopamine that have lower dopamine forms. Like, for example, you have a lot of board games that are loosely based on video games or video game concepts. A lot of the kids I work with like to play tabletop games. Um, you could do low dopamine activities like music or learning a musical instrument or doing arts and crafts. All of those activities may not be as boring as doing homework, but they definitely have more delayed gratification than being on your cell phone. Um, so you want to help patients find a balance. It's unrealistic to have a model where you just try to get them to do abstinence and have no high dopamine activities. I mean, first of all, they kind of need to be proficient on screens, and there are high dopamine or there are low dopamine activities that you can do on a screen, um, such as doing a word processor or putting together a PowerPoint or doing homework on a computer. Although what I warn families about that is that it's kind of like drinking water in a bar. If you're doing your homework on a computer, the danger is that you may have, a lot of games minimized that you can just pop right up, or the internet. So you have easy access to all that other stuff as potential distraction. So, you know, so it's important the environment that you're in as well. All right, so let's see. Let me talk about my general treatment approach. So we talked about the final common pathway in substance use disorders and problematic use of the internet, which is the dopamine pathways. Um, when I'm treating families and patients, I'll do a lot of work with the families on psychoeducation, which were some of the things I just showed to you. Uh, I will have a bunch of tools in my tool belt when I'm doing individual therapy with my patients, which is a big part of treatment especially for older teenagers. Um, I'd say I probably meet with a typical, let's say, 16-year-old, I probably meet with the parents like once a month. And I probably meet with the kids once a week, and I try to meet with the kids in person. Um, and so I'll use a motivational interviewing approach, which is, a type of interviewing. I mean, I'm sure a lot of you are familiar with it, but it's a type of therapy that was really designed to treat addiction, which I've tried to adapt as much as I can to treating screen use. It's kind of a mixture of CBT and psychodynamic therapy. I'll use some skills from CBT to help my patients, and I'll use some skills from psychodynamic psychotherapy. And one thing that we need to work on even more for treating this is group therapy, just like you'd use for any other addiction. But there's a limit of how much of that's available today for treating this, and hopefully that'll change. I'll talk very briefly about medication management because that's not the main focus of my treatment. And I know you guys want to have time to ask me questions. Um, so I'll bring the treatment. Usually I see treatment as three phases if I have a really bad case of gaming addiction in my practice. Whereas the first phase will be a dopamine detoxification, as I was alluding to before, something to try and get those dopamine receptors back. And this will often take coordination with the family. Maybe they'll go, oh, and by the way, I used to do it for a week as for outpatients. I mean, they can obviously go to an inpatient residential program and get a very long dopamine detoxification, because they're basically kept off screens for like a month or so. Um, but I found that uh, when I would recommend week-long dopamine detoxifications to families, and they go off and maybe go on a camping trip, let's say, I would often hear from parents by day 3 and say, "Wow, my kid's a completely different kid. Their behavior is so much improved." And so it really seems like the most withdrawal you get is the first 2 days of the dopamine detoxification, just from clinical experience, and that by day 3 you get a lot of improvement. Um, and parents will be like, "Oh my gosh, my kid's better. You fixed them." And I'd be like, "Don't get too excited, because if they go right back into the same environment, they'll fall right back into the same habits, right? Just because they're detoxed, and just because maybe now they're not constantly dopamine seeking, and they seem more patient and more pleasant, and they're not in this state of reward deficiency syndrome, it doesn't mean that they're able to self-regulate yet, right? And they could very easily fall back into the same pattern. So the second phase is what I call balance through external regulation, where these kids still need a lot of help, and varies depending on what age they are. Um, Finding a balance. They might need a lot of help from their parents, setting limits still. But the point is, it'll be a lot easier for the parents to play that role after a detox. The eventual goal of treatment is balance through self-regulation, because this is where you need to get kids to before they can launch. So among the family interventions that I'll work with the families on, like I said, often in a monthly meeting, I'll work with them on trying to give their kids as much structure as possible. So it's not just about low dopamine activity, but structured low dopamine activities. If these kids have after school activities for, let's say, maybe there's 3 hours of soccer practice, that's 3 hours where the parents don't have to be having power struggles with their kids about the phone. I like to talk to the parents about alternating high and low dopamine activity blocks, to sort of train these kids to delay their gratification. I like to talk about coming up with, especially parents of younger kids, logical and immediate consequences. In other words, you can say something like, "Okay, you have an hour on the screen, or maybe in a younger kid, a half an hour, and if you go 5 minutes over, rather than have a huge power struggle over that and try to pull the device away, we'll talk about." Maybe for every 5 minutes you go over, that's 10 minutes that you take off the next, uh, um, that's 10 minutes that you add to the low dopamine block, or that you take off the next high dopamine block. Just as an example, there's many examples, and you really do have to customize the treatment between different patients and different families. Managing environmental cues is probably one of the biggest key, because like, for example, during the pandemic, kids were coming home to a room full of devices and being told to do their homework, right? I mean, or to sit in a school classroom. Um, and their brain is being given all the cues. We talked about drinking water in a bar before, right? Their brain is being given all the cues that it's time to game, or it's time to get on social media, not that it's time to do schoolwork. So I try to have parents look a lot at this, and kids as well, the cues in their environment. What's in your kid's room? Is there a phone charging next to their bed? Or their screens at the table? Is there a way you can set up the home so that you have a low dopamine zone and a high dopamine zone? Maybe instead of like having the kid use a device wherever they are, and then you have to rip it out of their hands when their time is up, maybe you get them to go into a high dopamine zone, kind of like an arcade room. Maybe when their time is up, instead of you trying to get the device from them, you just have to get them to leave the room. This is often a really effective intervention with younger kids, and can eliminate power struggles. that's a common theme in a lot of my family interventions. A lot of them are teaching parents to set limits without having power struggles and kind of meet their kids where they are. Um, and so, yeah, think about the cues in the environment, think about, and remember, parents are a cue too, so when parents are on their phones, the kids are seeing that and they're modeling. Um, all right. And I also try to have parents have a balance in their parenting approach. Um, you know, because we want parents to encourage kids to self-regulate, but they still might need to set limits. But we don't want parents to go to the extremes of just completely giving up and enabling and saying, "Oh, I give up, just use screens all you want," versus the other extreme, which is micromanaging, right? So I try to help parents find balance just like I'm trying to help the kids find the balance. Okay, so I made reference to some tools in my tool belts. I don't really have time to go into details into all the modalities you can use, but I'm happy to answer questions about them. Basically, what I love about motivational interviewing is that it keeps the therapist from being just an extension of parental authority, and it allows the kids to have insight from within and be their own authority, and it helps them to explore their ambivalence. And so, Miller and Roenick is a great introduction to that. Um, Cognitive behavioral therapy, there's the most literature on for gaming addiction, and it's very promising. There's a lot of good evidence for it, but it's also much easier to study. An example of a cognitive distortion for a gamer is time distortion or fear of missing out. Psychodynamic psychotherapy. Well, I'm not going to go into detail, but you can, sometimes it's also helpful to figure out what gamers are getting from their games and what needs and drives their meeting. Um, and what sort of immature defenses like denial are carrying their addiction. Sometimes I'll borrow things from behavioral therapy like mindfulness from DBT, or I'll have kids get on exercise equipment in a physical therapy center I know that's actually gamified. And so it's really meeting them where they are. Uh, they can go on a treadmill, for example, and see an avatar that has to jump over objects while they jump on the treadmill, just as an example of many of these sort of gamified exercises. So there's lots of cool up and coming treatments for this. I'm not going to talk a lot about medications for it. There was like maybe just some small studies with not enough patients, but some promise for bupropion and atomoxetine, which is also known as Wellbutrin and Strattera. But just know that if you're going to use stimulants, they should naturally help it make it easier for a kid to get off a screen, like if you're treating ADHD with Adderall, for example. But it's only going to last as long as the medicine lasts. And it doesn't really fix the problem because you can't give them stimulants all night, which is when they're on screens playing video games. I don't want to go too much into group psychotherapy because there isn't a lot out there. And I already mentioned, residential centers. So I'm going to stop there so you guys have at least a few minutes to ask me questions. I'm sorry I had so much to cover in so little time, but I'll stay as long as I'm allowed to ask questions.
Thank you so much. You can go ahead and stop
Sure.
your share.
Okay.
That's that's always the common theme,
Oh,
right? Too much to
well,
cover in
there's
too
there's
little time.
more information you can get on my website and access to articles and longer presentations.
Excellent. So
Oh,
we've got I have four questions in the chat right now that I'll kind of just
okay.
ping over to you and we'll try to get through all of them in the next 6 minutes.
Sure.
So first question, what is considered heavy usage and are there research supported time frames?
Yeah. Well, I mean that's a good question. Like, because again, I wasn't defining the problem by the amount of use. And so I mean the research the, there isn't sort of a consensus established amount of use that's heavy usage. Most studies are going by, again, not the amount of use, but the amount of problems. Or some of them will use these standard screaming that in their studies. So, I haven't seen like some standard amount of time that's too much. And it's sort of like the question that parents are asking me all the time, like how much time is too much? I mean, I think again, it has more to do with how much problems you're having, and I think it varies from kid to kid. Um, and I think it has also the problem has more to do with, if you're trying to define what's heavy gaming, I think it has more to do with how much you use in one sitting than how much in a day, for example. So I think, like, for example, the American Pediatric Association puts too much emphasis on how many hours per day in some of their past recommendations, as opposed to, you know, how long as playing in a row is a binge. Is it uh if you play 5 hours in a day, but they're all spread out, I think that has a different effect on the brain than playing 5 hours at once.
Thank
Uh,
you. Okay, next question. What do you think about group work being done in the games such as Minecraft or even in Discord, thinking maybe not a great idea if we are looking to decrease dopamine?
Well, okay, so I think this question, I could be wrong, but I think the question is not asking about group work on gaming, but using the fact that it's a social game to do a group, right? Like just a way to get people to do group therapy, right? Because they're all sort of meeting in a social space. And I mean, I'm all about like using digital technology to do good. Like I'm not here just to sort of condemn all screen use. Like I said, I'm a gamer. I think there's a lot of wonderful practical uses of digital technology. I think there's a lot of educational uses. And again, I mean, I think that in a way the question answers itself. Like if the goal was to decrease dopamine flow, that might not be the best idea. If the goal was to treat gaming addiction or any addiction. But if the goal is just to get people talking to each other in a more comfortable setting, like for example, if you're trying to run a social group with kids in the spectrum, um, and you're trying to gradually sort of take them out of that setting, but just starting in a place where they're comfortable, like I can definitely see it being a useful tool. The thing I say about socializing in games is that it's not that it's better or worse than socializing in the real world. It's that it's very different from socializing in the real world. And kids, when they socialize in the game, are not getting the same exact skills that they're getting when they socialize in the real world. And it may be important to focus on real world skills too. So, I guess that's how I'd answer that.
Okay, we've got time for one last question.
Okay.
I'm going to do this one here from Ashley. I see distress caused from not being able to get on screens. For
Yes.
ADHD kiddos, they love the high dopamine, of course, but is balance the key? It's a struggle for everyone.
Yeah. Yeah. I mean, that's that's a very true statement. I mean, it is a struggle for everyone, right? And I think there's two skills that we can train in our kids through balance, which you can't train in them if you're just talking about abstinence and trying to keep them off. One of those skills I mentioned, it's delayed gratification, like in the question, waiting to get on when you're not on, right? And that's a skill that I think can be developed, that, even if it's a weak skill, you can still try to improve it. Um, and then, by sort of training delayed gratification. And then the other skill is using the brakes, like stopping once you're already on. And those are both things that my patients struggle with, so it's like they have to get on the minute they get home. And then once they're on, they can't get off. And those become like the two biggest problems. But again, those are two things you can't work on if you just have an abstinence model, right? Like, so having balance in the treatment plan instead of just completely permanently detoxing them, allows them to work on those skills. And, you know, I would just say to parents that you don't reward improvement with extra screen time, because that's kind of like, giving someone an ice cream sundae when they follow their diet successfully. Basically, you're trying to go for like the appropriate diet, the appropriate balance of screen time, and be consistent with them. Your rewards for them following your plan and following the rules might be, you know, uh, immediate rewards. Certainly, delayed rewards aren't going to help, as we know. But they can be things like, points towards a pizza party or ice cream, or even getting a new video game, but not having extra time, extra screen time.
Dr. Sussman, thank you so much. We are out of time, but I think we could have talked about this for probably another hour. Thank you so much for a really great presentation. Thank you for presenting to our Idaho
Pleasure.
audience from all the way on the East Coast. Um,
Yeah.
we will be back in 3 weeks, actually, on Wednesday, November 5th, where Dr. Casey Knudsen, who's a child psychiatrist and the medical director of children's behavioral and mental health at St. Luke's, is going to be giving a talk on social media and mental health. So, kind of continuing this conversation a bit more.
Yeah.
We hope to see you guys then. Have a great rest of your day. Don't forget to fill out your post-session survey. Thanks, everybody. Thanks, Dr. Sussman.
Thank you. Bye.